forget your gender. Just look at yourself as a person and what you are attempting to do, what you want to achieve in the goal. Gender is one aspect of it. Just unless you forget, you cannot give your 100%.
We are in conversation with a computer scientist turned social entrepreneur.
More than 75% of the ladies who need to be screened cannot be screened with the current method. We've developed a new method of detecting breast cancer, which now is used in 22 countries.
So what do you see is the differentiators in the innovation that is happening in India and, innovation that's happening possibly in the US or Israel or, any of those?
We don't need a US FDA to sell in India, but there is this mentality that if US accepts, this is better. If US investors put in, then I will also put.
What is a generative AI and what is an agentic AI?
The thing is, one is a technical term, another is a marketing term. That's how I look at it.
Okay. What is a supercomputer?
Now whatever was a supercomputer there is now in the phone. There are generative AI based applications where it's not generating poems anymore, generating programs.
Yeah.
I was one of the 2 women in the whole class of 100 plus people in my masters. Even in my career, definitely I know that I had to work double to be treated as equal.
Who is one woman in the STEM world whom you greatly admire? Hi, and welcome to yet another episode of the We Women Project. Today is an episode that I've been greatly looking forward to. We are in conversation with a computer scientist turned social entrepreneur. So honored to have you with us, Geetha. Thank you so much for making it happen amidst your busy schedule, making it here. And I think your journey is nothing but inspiring. What you're doing in the space of AI, in healthcare, is, I'm sure, something that each one of us would want to know more about. So thank you once again, and such a pleasure to have you.
It's my pleasure to be on your show. Thank you so much for inviting me, Vilasini.
So Geetha, I think, we'll quickly give the audience a little bit of an introduction to what you do. So you started NIRAMAI, which is an AI healthcare platform. So one thing when I was going through your journey, one thing that struck me was that you've been identified as Forbes top 20 self-made women. And then when I went back and read, it started from this entire journey started from a personal loss, which is, was kind of sad to read. But I'd just like to understand from you, how this whole thing has panned out, when you decided to start this. Please, if you can talk to us about it.
Sure. Basically, as you said, I'm a computer scientist, techie. I used to be heading the AI lab for Xerox Research before I started NIRAMAI as a lab director for Data Analytics Lab, as we called it. It was excellent, wonderful set of team members together working on emerging technologies and future of several applications where computer-aided analysis could be done, particularly AI and machine learning, including education, healthcare, customer care, transportation related. So multiple things. But suddenly one day I heard that one of my cousin sisters, Bharti, was detected with late stage breast cancer. She was just 42 years at that time, and it was extremely shocking because it was 4th stage and the doctor said they'll do what they can, and she had a surgery, and within 6 months it recurred, and I lost her. So that was a shocking moment. One, of course, she was more of a friend than a cousin sister. So that loss was one. But more importantly, looking at how many such people are just losing their lives because they are detecting their breast cancer late, right? So that was a thought. So initially, I started a small exploratory project within my lab to just see what is the scene, how are the sort of the different imaging available, and so on and so forth. And then, unfortunately, I lost one more of a relative, my husband's side, who died at 38 years on her son's birthday.
Oh.
That was the limit. And I just generally thought, I mean, because I had like 30 other projects to handle. So I said, I can't do this among many others. And I decided to quit and start NIRAMAI. So it's now been 8 years. And I think by God's grace, we've come a long way. We've developed a new method of detecting breast cancer, which now is used in 22 countries.
Phenomenal. You know, the moment I saw, I just chanced upon reading about you, but the moment I saw you, I realized I had to have this conversation because I think it's an intersection of two such deep fields, and from where you've come and what you've started, so wonderful. What does NIRAMAI mean, Geetha? Why NIRAMAI?
Actually, in our, I guess, Vedas, there's a Sarve Santu Niramaya, right? Sarve Jana Sukhino Bhavantu, Sarve Santu Niramaya. What that means is let everyone be happy and everyone be healthy. So Niramaya means healthy, basically. So initially we put Sarve Santu Niramaya as our motto for the company. Then I thought, why can't it be the name itself? And then so that's how NIRAMAI came in. But we didn't want to use a Y. We had an AI. So
yeah, that's an interesting twist to it.
Yeah, we expanded it. I always wanted a Sanskrit name with an expansion which sort of means something that we are doing. So we have tried like 100 such names. Finally, when this happened, we expanded to non-invasive risk assessment through machine artificial intelligence.
Wow. Okay, that's what it is it?
That's what it means. So because we are trying to detect breast cancer in a non-invasive way. So that's
non-invasive?
Risk assessment.
Risk assessment.
Risk assessment.
Okay. Wonderful. Oh my God, that's all a scientist thinking, I feel. So before we get started, Geetha, you know, we'll just like do AI for dummies or, you know, this ML for dummies sort of a thing, because often I also get confused. There are so many companies, you know, claiming to be AI, or everybody is talking about machine learning, everybody is talking about deep tech. So according to you, if you have to give a basic understanding to someone, what is AI, what is machine learning, what is deep tech?
So first and foremost, AI is the sort of the all-encompassing intelligent way of doing things. So what is intelligent way of doing things, right? So earlier, people have written like bank applications, COBOL programming, Fortran programming, and obviously C, C++, Java, where you write a set of instructions to accomplish something, right? Where you say, okay, you want to count two numbers, you'll say, give me A, give me B, and output A plus B. Simple, right? These are the steps. But when you start making decisions based on the input itself, right? You know, whether you will do A plus B or A, whatever, star B or something else, depends on the kind of data distribution you're using, right? The logic itself depends on the type of distribution. Distribution means the kind of patterns that exist within the data. Then we start calling it like machine learning, artificial intelligence, and so on. So the difference between the two terms, generally, the way I think about it as a technical field, is that AI is sort of a union of all such smart ways of using data, right, to make intelligent decisions. Machine learning is one major segment or section of methodologies which use statistics and probability theory as the main thing. Functional modeling, statistics, probability theory, a lot of more mathematical modeling coming into it. So machine learning part of it. And the second method, for example, you say what are the methods, right? Is for example, using semantics, right? Logic, right? Logical. So if you're calling somebody as a father, he's also a parent. If you're calling mother, obviously she's also a parent. So this kind of relationship between the words, the semantics, the meaning of the words, capturing that and so on, is another kind of semantic modeling. Then also logical reasoning, like first order logic, second order. So there are different other methods which are not statistics and probability oriented. So all of them put together, the overall term, like general English term is the artificial intelligence we use, but more and more we are seeing machine learning taking up equal to AI, literally, because now people are seeing how to use machine learning in semantics and how do we use semantics in machine learning. So all of that it's not at converged, but it is going towards
very
that.
rapidly moving
absolutely,
in that
absolutely
direction, right?
Absolutely.
All of this would have come to shape in this form in about 2018, 19?
In the last decade is where, of course, all of the newer methods of neural networks and so on have emerged as really useful research tools. Of course, neural networks were there way back in 1990s also. But because the computing power was much less, it used to take let's say 1 month to train, let's say 3-layer models. Now we can have 10, 50, so many layers, and then quickly train them because of the GPUs and others which have come in. So now it becomes feasible to kind of almost model like our brain, right? Our brain is also full of neurons.
Neurons, yeah.
So similar modeling, high volume modeling, high number of nodes being modeled is possible now. So things become much faster, things become much more smarter, more like the combination of what you can think in 10 years, if you think in 10 seconds. It's amazing, right? Brain itself is such a wonderful tool. So that's what this is.
So you say that, the neural network in 90s to now, the key difference has been the computer speed, or the computation speed.
We are able to model more complex problems in more complex way.
Right.
And the second thing that has changed is also the digitized data, right? And now data is available. Like earlier, obviously, it was pen and paper, and who will convert the pen and paper stuff to digital and all. Now, even if you go to a hospital, like the doctors are all using laptops
and the data,
and there are a lot of variables now which keep on producing data, every second, every millisecond, and so on. And even our phones have so much information about ourselves, including the health information about ourselves. So all of this availability of data and ability to crunch data, as I call it, both and also there has been a lot of research enhancements, because it's possible to do experiments. You can actually come up with new algorithms, new models, new configurations. So I think it's a wonderful time to be
in
born.
This space.
That's so because I heard somebody saying, what's the midpoint of sort of overall, now we are in 2025, what's the midpoint? Say midpoint is 1900, they say. Like whatever happened before 1900 was easily accomplished within the last 100 years, is what they're saying. And then midpoint of that is more, 2000-ish, not 1950 or whatever, 2000. And midpoint of that is almost 10 years ago. So the amount of, midpoint of development, I'm saying.
I get it. I understand
kind
it.
Of,
I took a while to get it, but I understand it.
Logarithmic kind of improvement that's coming in.
Innovation
in terms
and
of
catching
acceleration
up.
of innovation and all of that. So I don't know what the next 5 years itself is going to be very, very different.
One thing in the AI space that I still want to pick your brain on is, what is a generative AI and what is an agentic AI? How would you?
The thing is, one is a technical term, another is a marketing term. That's how I look at it.
Okay.
And that's one aspect. The second aspect is generative AI is basically, typically AI can be used for in different scenarios, use cases. So one would be, for example, machine learning called supervised learning. That is, you teach a model how to categorize between two classes. For example, a dog, you show like hundreds of dog
images.
Photos, hundreds of cat photos, and learns how to differentiate between dog and cat. Something more interesting, you can show images of chest x-rays and say who have lung cancer and who don't have lung cancer or breast cancer. So these kind of, categorization is possible. This is supervised learning where you train the system and, and then you use the model which is developed, which is a mathematical model, to predict the next answer, as we call it. But as more and more such things can be done with so much more data, there are certain unsupervised information that the machine can learn. That is, you give a bunch of millions of images try to find a pattern in this, which are meaningful. Or among these 1 million, few of them will have labels, we call it, whether cancer, no cancer kind of thing, labels. Then it will try to sort of create or understand what are the patterns which worth looking at, and then use that small sample with labeling, and then learn. So these are semi-supervised and so on and so forth. We're going more and more into it. Now we are in a place where we can try and generate newer data, newer samples, we call it. So it was there a little bit, but now it is possible to make the models creative.
They do their
use
own thinking.
more of these things, and then generate newer varieties of it, newer images, whatever data point you want to look at, right? So that is where we are making the models more creative, generating the data itself. So that roughly, high level, that's what forms under the generative learning. So, for example, it can write poems. You would have seen, right? That's my favorite. Write a poem about NIRAMAI, and it beautifully does, looking at all the data, and then does that, right? So there's a creative element that's coming in. But the only aspect that still needs research here is there are certain times where it will confidently make mistakes.
They call it delusional.
It's called hallucination.
It's
called hallucination.
Correct.
So, right. So this hallucination is a problem because we don't know when it is hallucinating, when it is not. Somebody described that as having a very, very smart intern who can get drunk once and you don't know when he's drunk. That is how, there are different methodologies, ways of explaining that, but that is a problem, right? We don't know when it is right, when it is not. So you just have to validate it. There are some research work that is happening to check that also. I'm sure it will get solved in the next 5 to 6, 10 years for sure. But that's the generative angle, right? The agentic AI is typically, the term is used when you are using this generative AI in the context of an application, right? So that's usually how the terms are used. But just like machine learning is one version, AI is the sort of little bit marketing and a spoken version of it. Agentic AI forms under that, but it's more application centric and things like that.
More use case centric.
Let's say you want somebody, some model which is generating a PowerPoint for slides for you, that comes under agentic AI. So some companies also call these as co-pilots. They call it along with you. You are driving, but there's somebody else who's helping you, or it's driving and you're helping, whichever way you think about it. So there are different terms that's used, to
understand.
Understand.
So Geetha, all this that you were talking about, the computational speed and all, one thing that was quite fascinating in your journey is that you were part of the first supercomputer making in India. Am I right to say that?
Yeah. For supercomputer from India.
From India. Made in India.
Yeah.
So
definitely.
What was your role in that? I think that was your first job.
Yes.
Talk to us.
I came out of Indian Institute of Science with my master's and flying colors, if you will. So I had a dream job. They asked what it is, and IISc makes you feel like research is the only thing you want to do, and it helps you enjoy doing new things. Just for the sake of doing new things, and just for that creative, that aha moment aspect of it. So I wanted to be in research for sure, and I wanted to be in India because Mera Bharat Mahan.
Lovely.
So that's how it was. And then there was only one company or institution, to be specific, which was doing research in computer science that was recently or newly started rather, CDAC, Center for Development for Advanced Computing. And so that was my dream job, and I got it. So the whole team under Dr. Vijay P. Bhatkar was building the first supercomputer from India.
Right? What is a supercomputer?
So okay. now whatever was a supercomputer there is now in the phone. Anyway, that's the growth of computing acceleration that we're seeing. But okay, I can go into the board kind of a thing. So there are, at that time, we were thinking about supercomputers, 2 types, right? Where multiple computers are working together to solve the problem, right? Where it is like distributed computing. In both the cases, it was about one computer was not able to do
All
as
that.
fast enough, right? Then we were using 2000 such or 1024, that kind of, distributed computing, it's called, like a group of computers working together. That was the model of supercomputer at that time, but it's evolved. There are like so many other models now. That is the distributed computing model. So India was developing what's called as Param, which is the hardware where they put together like these, connect up, how to connect up, how do they exchange messages, why will they exchange messages. There are a lot of complicated stuff there. And then the software for it. I've always been like a system software plus person. So I really enjoyed writing software for like across all of these 2000 computers. And so that was the main thing. So initially, I was like a young engineer joining the huge, beautiful, very, very smart team. But I still cherish, my first 1 or 2 years was like super learning for me. Because it was all new and really making it work and make the application that is the application you're developing should not know that it's working on 2000. So it's very interesting actually.
What was India using it for? The supercomputer?
There was a whole team, an applications team in Pune, which is working on weather modeling, fluid dynamics simulation for some physics applications and so on. But it was just the fun of building it and making it work for like really fast, like 100 times faster or 1000 times faster. That was the system software kind of a thrill that was there. And I joined in as an integration team member. So that means I had to learn all the modules together. Then I went on to lead the compilers and tools team. So that was my specialization. I really loved it. So that, and then I remember having goals like we should be faster than the US, supercomputer at that time, or at least the compilers. So we were able to beat those benchmarks. So it is like more about Indianness, about working in the cutting edge at that time.
Yes,
and,
absolutely.
Even now, these machines are being used actually.
Wow. So you were amongst the pioneer computer scientists, I would think, in the country, right? At that point of time, must be an early batch of computer science grads, engineering grads.
I was the second batch.
You were in the second
engineering in from Bangalore, Karnataka. What now is called the Common Entrance Test. No, ours was the first batch way back. Wow. So that was true. But it was the second year of computer science as an engineering branch that started at that time. We were like, it was a small branch. We were about 30 people in every college, not like hundreds like in electrical and other. So that way it was a smaller branch.
I have two questions, but first we will delve into your childhood. Like, how did you decide to do computer science? Who guided you on this path? Why IISc? How did you know about it?
Again, we are sort of going a little bit earlier flashback where computers were not in every shop and every house, no way, right? Not even every college. So I remember seeing right after my schooling, I guess, I saw in one of the conferences like some kind of exhibition, right, with computer, and I was so thrilled to see that a machine is saying hello. And it was so funny. But anyway, so that is how
you grew up in Bangalore?
Yeah, I grew up in Bangalore. Yes.
Okay.
So I remember going there. And then, so that's when I really got excited. I had this sort of mentality. My mother is, of course, a music teacher and so on and so forth. Okay. But my father was more hands-on, like engineering mindset. So anything that I see, if I'm fascinated, I want to know how it works. And that's been my childhood fantasy for everything, opening it up and seeing and all. So the same thing here. I of course I couldn't open up in the exhibition, but I wanted to learn. So I joined a course where they were teaching programming, but that's okay. But it got me to learn about computers a bit. But then I was like very interested. I was very good in the programming class and all of that. Youngest in the class, whatever at that time. It was like external programming class that you get. So that's when I was interested. But when I got an opportunity after second PUC, I got very good rank both in engineering and medical field. I got the best medical seat, and I had to choose the engineering seat. And computer science was, as I said, the second such year, but I said like, I want to learn this. I don't know what it is. I know a little bit, but not too much. But so that's how I chose. Of course, there was a lot of pressure. Oh, you're a lady. You should. Maybe it's better you be a doctor because you've got the best doctor. I got in Bangalore Medical College, which was even now the best in Karnataka. So, but my father was there. He said, "You choose what you like. You do what you like." And I had many relatives visiting. Are you sure? Like, how can you choose engineering and all of that? But I really loved physics and maths and the computer aspect, and I chose that. So for that, I go full on with my dad, who
kind of
credit to
supported you
him
for
said, "You just do. Don't worry about what others are saying. Just do what you like." So that definitely, even now, I remember him for that. Yeah.
Oh, lovely. And IAC?
I see, incidentally, when I was the final year of bachelor's, I had a friend, Nalini. She's now a professor in Irvine, California. A classmate whose father was a professor in IISc. So once I went and visited him with her, and we did our final year project in IISc. Oh my God. There was like terror scientists, but I saw how much more learning that I can do. They're there and we are here, and you just see that there's so much more learning possible. So it was my dream next step type. So after BE, though I didn't study much, but I did manage to get good ranking in GATE, and I chose IISc. I was like, I don't know whether you've been
Yes, I've been to the IISc campus. And
I mean, when I go there, I feel every leaf Saraswati is there, and every professor is so knowledgeable, and not distracted. Just science for the science sake.
Purists,
very much purist. Though I am not a purist as such, I always want to see an application on the ground when we look at a new innovation. But being like that is difficult in this world, and if we don't have such people, then science doesn't move. I think it's the need from both sides. So even when I wanted to do my PhD after 15 years of industry, I said, if I do PhD, it has to be IISc. I'm
so
like that.
Went back after 15 years and you did your PhD then. Okay.
Crazy,
lovely,
right?
lovely. No, it's phenomenal. I think it's so inspiring. So, that comes to the point that I've seen IISc have incubators. I mean, how are all the educational institutions today in our country enabling, AI or all of this massive growth that's happening in the country? How is it being helped at the education level?
So, of course, none of this is happening because for the sake of AI per se.
I would imagine.
There's a lot of demand for AI courses from people because there is good, not hype, there's reality also. There's more money in the AI based, and AI is going to be the future in whichever area you are there. AI will be part of it, just like now computers are there in every pharmacy, so the same way AI is going to go there. So it becomes mandatory piece. But now computers are computer courses are there, or lab is there for every branch of engineering, for example, right? So in the same way, in future it will happen. But at this time, many of the engineering institutions are starting AI-based courses or AI electives and so on. Some of premier institutes like IISc and others have already started designing MTech in AI, data science, and things like that also. But the thing is, AI is basically, or to work in AI, it's kind of multidisciplinary. It doesn't have to be only the math part, which is the machine learning. AI almost equal to machine learning now. So it doesn't have to be the probability theory, statistics. It's good if the person knows that, then he can do fundamental innovation, get the best out of the algorithms that are being developed for a specific application also. But nowadays things have developed so much that there's black box mode for everything, right? For example, Just like if somebody knows a Java program or even Python program, they can quickly write up, use this as a library and continue. More so, there are generative AI based applications where it's not generating poems anymore, generating programs. Right? Writing or developing a mobile application today is literally 20 minutes job. You know exactly what you want to do and you know how to chat with the GPT part, right? So it's really fascinating how the application domain is also developing to the right field. Anyway, so coming to the academic institution piece, I think based on wherever the jobs are taking, they are aligning. That's how I understand.
Understand.
Yeah.
Okay. Thank you, Geetha. I think I took you, to a lot of generic themes, before we get into your work. So I'd love to hear more about, NIRAMAI and Thermalytix and how does it work? How does the system, if you can just explain.
Sure. So as I mentioned, at NIRAMAI, we have developed a new method of detecting breast cancer. If you look at the current methods, right, the only standard method is something based on X-rays, which requires the breast to be placed between two plates, uncompression, and which is fine because that's the standard. However, this will not work on women with dense tissue because X-ray based analysis only detects cancer with density differences. And almost every lady under 45 years tend to have dense tissue, which means there's no cancer screening test for them, which is standard. And more than 50% of ladies above 45 also have this. So there's considerable, like, and if you assume it's a flat world of age distribution, more than 75% of the ladies who need to be screened cannot be screened with the current method. So that's the gap, because of which what we are having is like 680,000 deaths every year. That is 2,000 lives going away every day just because of late detection. There is no screening test for them.
So when you say there is no screening, that means the anomaly that exists will not come out if it's a dense tissue.
Yes. So when I say there's no screening, it's a good question because screening is like when people go for a test when there is no abnormality, no symptom, regular preventative tests,
checks,
right? So that's very, very important so that we can do early detection.
Correct.
Alternatively, what's happening today is women wait till there is a big lump before they go to a hospital, go for another test or a biopsy and so on, which means they have to feel the lump accidentally. So it's about 2.5 centimeters, which falls under stage 3 directly. So we are detecting more than 60 to actually some say even 80% of cancers after stage 2. And stage 1, stage 0 cancer has a survival rate of 90-95% beyond 5 years, whereas a stage 4 cancer can have 10% survival rate after 5 years. So survival rate really steeply deteriorates if it's the later stage. So anyway, so that's the sort of the context of breast screening. So when I lost the 2 cousin sisters who are under 45, I knew it had to be something that can work on young women as well. So I looked up, and then what we have developed now is an imaging-based, infrared imaging-based test. We use a simple camera like these, which measures the temperature variations on the chest, not the real picture, but a temperature picture. It takes, and then the AI models actually convert the temperature map to a cancer health report automatically. So now, first of all, it's extremely portable. Just like this, we have a small camera, put it into a backpack, take it out and do the screening in community, rural areas, at home, offices,
so
everywhere.
Like I can be in the sari and you just take a pic.
No. The protocol we had to determine.
Okay.
So what we do is we have a changing room kind of an environment where there are 4 curtains or 4 walls. Lady enters, she closes all doors and curtains, and then the top clothes have to be removed. And then you sit in front of the device. But nobody is inside, not even a photographer.
Understood.
This device is controlled from outside.
Understood.
And we blow cool air for 5 minutes because it's what we call as contrast enhancement is obtained. And so the cancer cells continue to sort of divide at a higher rate compared to the rest. And take the 5 images. The lady comes out, the report will be ready. So
Oh
it's
my
very
goodness.
simple, where
Ah.
no one sees the person without clothes. No one has even touched. There is no X-ray or anything, because we are all emanating infrared rays and it captures it. There is no extra rays coming. It's very safe. And best is, it is 10 to 20% of the cost, right? And portable, all of
Portable,
that
and
as well. So,
so
and it's accurate, of course.
I was
Without
just
that,
going to ask you that.
it is,
How
of
did the
course.
accuracy kind of build on this, or how did you I think of this, Geetha?
Yeah.
I mean, it just sounds.
Yeah, no, the idea of using thermal imaging for breast cancer is not my idea. It's been around,
Okay.
but around, as in like world knew it. In 1976, there was a paper and so on and so forth, which was pointed to me. But what has not happened is it's not available everywhere. It was not available even 8 years back when I started. That's because while medical field knew that there is a temperature variation in the tissue, whenever there is a cancer cell, there is higher multiplication and hence higher temperature. But when you take an image with a thermal camera and do a visual analysis, you can only see 1 degree Celsius differences, which is not sufficient to identify or differentiate between cancer and non-cancer, because there are so many reasons why something could be hotter than the other areas, right? You can't just call anybody who has a red patch as cancer. That makes 60% of people cancer, which is useless, right? So that was what was happening before. So they were taking an image, visually trying to identify and say, oh, there's something, do another test. And almost 60% of them were coming positive, and then they were getting improved. So it's not really usable, right? That is called thermography. But what we have done is to add AI to it, right? And with the AI, multiple things change. One is, of course, we are able to do faster analysis, more deeper analysis than visual, obviously. More importantly, the data we are getting is not the image anymore. I can hook up my computer to the thermal imager and extract all the temperature values. So we're extracting 4 lakh temperature points, every temperature value being highly sensitive as 0.02 degrees Celsius, and then building patterns or identifying patterns which could be looking like abnormal, which could be patterns of an abnormal tissue, and at the end of the day, saying whether there's cancer or not automatically. So that's sort of roughly how it is. So it's AI plus thermal that is. So when I read about it, I really got fascinated by this methodology, but I was very surprised why it's not being used, given that it's radiation free and non-touch. And then I realized it's accuracy issue. So started working on that angle.
So when you were building this model, or when you were building the, so what kind of data sets or what kind of data required to be utilized for it to come to this level of accuracy?
It's a great question. I read a paper like, but I don't even know how a thermal image looks like. I had never seen a thermal imager. So we started off from there. And incidentally, there was absolutely no data available. Okay, to just like now, if you go to the web and say mammography, and you can actually download millions of data saying whether there's cancer or not. So it's very easy to develop an AI model for mammography, for example. We developed in 15 days, very, very high accurate. It is possible. Now, when you don't have the data and you don't have the labels of this data, for example, if you take a thermal image and show to a doctor, in most probability, you'll not find any doctor who can confidently say whether there's an abnormality on that, because it's not physically, humanly possible to
you said,
accurately identify, right? As opposed to, let's say, a mammographic image or a CT or an MRI, where there's a lot of training and all of that. This is new field, right? So that is what was the thing. And so we had to actually create or develop all the training data as well. So when I said I'm going to do this, then I collaborated with the hospitals to collect thermal images of cancer patients who already knew they had cancer. So we wanted to see how do the thermal images look for them. So we took the images and then stared at each of them along with the doctors to try and understand how this is. First, to get the semantics into our head, and then, of course, develop the models to identify the area of cancer. And the next step was, I said, like, why do we want to image people who already know they have cancer? Then it's not going to be helpful. So we have to make it a screening test, and there's absolutely no normal thermal image available. So it started off in that direction. And today we have almost more than 1.5 million thermal images of breast, everything taken by me and my team. Our team basically.
Wow.
So that's a data set also we had to create. And in order to know what is the label, like, cancer, no cancer, where is the abnormality? Again, we couldn't show the image to a doctor and ask. So for all of those initial training set people, we requested them to go through a mammogram, ultrasound, and biopsy to get the label for the training. Yeah, it was humongous. It was 1.5 years for 256 data points. I remember the first one, and it requires patience. And conviction, in the sense, like, first of all, you have to be convinced that this is the direction to go. So there's a lot of this, factual check, experimental check that you do first, and then invest more time. So that's how it's happened.
So today, is the protocol reversed? I mean, once they know, you're saying by the time you come out, you know a diagnosis. Does it still follow up with a mammogram, with a biopsy, or how does the medical system testing. How does the medical system use
for testing to prove that our models work? Then we compare with mammo, ultrasound, and biopsy.
I'm talking about a real life patient.
Real life usage, not necessary. In many of our centers, this is the first test that is done. Only if this is positive, an ultrasound or a mammo or further imaging is recommended. Okay. So basically, we have designed it in a way that it is a screening test. Filtering test. So every person needs to go through, whether there's a lump or not, whatever is the age group. In fact, male gentlemen also can get breast cancer, right? Which is a smaller number, but there's no test for detecting breast cancer in male because the way the machines are structured are different. But this can be used for that as well, especially people, men who have family cancer history, right? Should do the breast cancer test as well. Why not? I mean, because they can be BRCA positive and they can get it. It will get detected only when it goes to the lungs. So that's not the right way to do it, right? So anyway, so all of those, so essentially it's a universal test for breast screening. And if our test is positive, then they go for mammogram.
Why only the breasts, Geetha? I don't know. It's a very dumb question. I'm not sure. But if it can be other parts of the body, but is it deeper, or, this thermal imaging happens at a much superficial level? Like,
first and foremost, breast cancer is the top cancer. Okay, 27% of all cancer deaths are because of breast cancer, right? The next one is like 10% or something like that, right? It's really, having said that, but your point is valid that thermalytics can be used for other types of cancers also. But medical field is like this, so you have to figure out what is the intended use, what are the claims, prove it thoroughly for that particular indication, we call it, right? And then we can move on to the other indications.
Use case, so you have to.
Right, use case, because to prove that it actually detects cancer, all cancers, if you will, all breast cancer seen, and not detect too many false positive. It's not that itself. And then there are things like how deep can it go, and what types of breast cancer it doesn't detect or it does detect, all of those. So there are so many types of testing and experimentation you have to do to make it like a foolproof new screening test. Or rather clinically validated accepted, test, right? And after that, we move on to others. But we've already developed a device, software, which can analyze any part of the body. And we can't say whether it's cancer or not. We can figure out whether it's abnormality or not today. Otherwise, we'll require enough amount of data points of both positive and negative.
True. Again, you'll have to create another data set and you'll have
for
to build
each one of them. So now we have made it more like a platform where we know it's like what we have developed with this new platform is like new biomarkers. Like genetics, you have different. So similar, like a biomarker, we call a group of biomarkers called thermal radiomics and vascular radiomics. So blood vessel based biomarkers and thermal activity based biomarkers. So these are available for any part of the body. Now using that, we have actually opened up the platform to other researchers and clinicians to combine together and develop
and
each
figure
of
out
those.
what
Because
they
there
can
are like
be.
20,000, 25,000 type of abnormality. It need not be just
Yes.
cancer.
Yes.
Any vascular abnormality can be detected. So
Yes.
actually, the reason like people get excited about our work is because yes, it is a new affordable accessible method of detecting breast cancer, but it is probably evolving towards being a new way of looking at the body.
Yeah, it lends itself
Yeah.
to too much.
Yeah,
Yeah.
and early and radiation
Yeah,
free.
radiation free,
Yeah, all of those.
portable.
Yeah, it's like what when X-ray was not there. If somebody invented X-ray,
Yeah,
oh my
yeah,
God!
yeah,
Like
yeah,
how
yeah.
X-rays have been used here, right?
Yeah,
That is what
where we are
thermalytics
today.
is. Yeah, that is what is thermalytics.
Thank you. Thank you, Geetha. So, Geetha, I think AI in healthcare is something that's been worked on for quite a while, right? Globally, also. So, what do you think were some of the key milestones, key things that are happening currently, or what has happened?
Actually, AI applications first started off in non-healthcare because when you're developing an AI model or an application based on AI model, the chances of error or the impact of an error rather, right? What if the tool makes an error and how does this sort of, spoil the system, right? So when you look at it that way, Netflix or even Ola, Uber, you name it.
Chess
even
games.
Simple Google search, right? Okay, we'll take Google search, right? You give a few words. Of course, it requires a lot of AI behind to get the best one up and so on, right? But if you show something on top, it's great. But if you show it on the third, it's not so bad, right? You anyway scroll down and you click on it, and the AI learns that you didn't click the first one, you learned that click the third one, it goes back as feedback, and it actually improves. But the same thing, imagine instead of in the four people, if one of them had cancer, you called somebody else's cancer and not this person, you're harming both the people, right? So that's sort of the intricacies of it. So where I feel like the accuracy needed for AI models to work, and especially clinical aspects of the healthcare, is literally like walking on a thin rope on top, right? You can't make mistake in missing the cancer because obviously she will think she's safe and things like that. So sensitivity, we call it. And you cannot call too many people as positive as well, because then the person thinks, why, even if they do a follow-up test and that next test is negative, why did Thermalytix say
are also not
so it can be a mental sort of an issue later, psychologically it will be affecting her. So we have to be really balancing right way and messaging the outcome also in the right way. So actually, going back to your question, AI in healthcare is almost pretty much the last one to get impacted when you look at AI applications, right? From the viewpoint of where I am, right? I'm sure many of the other people also will agree on this. Also, AI in healthcare has regulatory requirements. That is, you can't just try it out on people without a regulatory clearance. The regulatory will not even. I mean, ours was the first software-based medical device that was audited by a very, very smart group of auditors that came in.
Which
from
body governs this?
In India, it is the CDSCO organization, Central Drug something. And then, of course, US FDA. And Europe, we have the CE mark. So very, very few software-based AI. So that's very, very recent in the last 5 years, 6 years max, right? So when we look at AI in healthcare in general, though, there are two groups of applications we can say. One is clinical, like cancer, no cancer, whatever, that one. And the second group is non-clinical. Like, for example, get me the right doctor who knows best for this particular patient, right? And things like that. Or look at all the data about the patient, summarize it. These are a little bit less clinical in nature in terms of the impact and so on. So those were developed before, even before a decade. You nowadays see dictation systems, right? Because doctors don't, like they're doing the analysis, they want to just dictate and it has to get transcribed into a report.
Yeah,
So
the
those kind of
conversational
non-clinical
AI.
decision support, as we call it, systems, CDSs is the terminology. Non-CDSs applications have been around. We see them in many of the hospitals. But the only thing is that the data from one country, one demographic may be different from another. So you'll have to sort of retune, and the application scenarios are different, the clinical pathways are different, all of that, right? So that way there is a little bit customization that is done for those applications, non-clinical. But those have been around in the last 10 to 15 years. You would actually see those pretty much used. And only recently, particularly AI in clinical radiology, has been one segment where you actually see AI being adopted, not as an independent assessment, but as a supplemental, collaborative, co-pilot, as those kind of modes have been used.
So how long does it typically take from being a lab prototype to actually, driving adoption or scale in any of this?
So it's a good question, because this is where I have seen that most startup founders in healthcare AI clinical applications fail, is that we are in a hurry to try it out in the ground, because we are under pressure of making money or whatever. So you want to are really making it useful to the user. So suddenly we want to buy. It's not possible that way. So first of the lab testing, then first of all you need to have the data to do the retrospective analysis. Then there is something called prospective analysis. As and when the patients are coming, the classification has to happen, the prediction should happen, right? And then you should leave the tools in the hands of people who will use it, right? Field workers, community workers. That's called the RWA, real world evaluation. And then, of course, the field-based evaluation. So multiple steps are there. First round, when we released our software, we released as just a helping tool to the doctor making the main decision. So that in a very small scale, we were able to do it in one hospital, get the feedback, work with another field team, the Karnataka Cancer Society, for example, to go with them. They were doing screening with hand, and we say we'll do screening with this also. So smaller applications, ensuring that the impact is not much, you can do it once you have the regulatory clearance. But for large scale adoption, we need multiple of these clinical studies to be done. And after that, we'll be able to roll out much faster. So typically from a lab prototype to, we just took 1 year for the first customer to come in, because we already had the doctor as the front end, and this is just assisting. And then unfortunately we had COVID when we were almost ready to scale, and all the clinical studies were done. So post-COVID has been the most fruitful. After that one, it has been
last 5 years. It is kind of built out. So are there any peculiarities, or what is the differences in an India data set to maybe a global data set? How does it, especially in the medical field, how will that vary?
Yeah, so the data set in India, if you again, I'll take the breast cancer example, just staying with the theme. When we do a screening camp, like simple population level screening, the people who are coming there are those who have never had screening in their life. So you will see this big cancer and very small cancer. Most of them are coming in because they already know that there is something going wrong with a lump, or possible like look alike like a lump, whatever, and they come in. So we actually see almost 50%, or it depends on where we are doing and all, but a lot of symptomatic people coming in, and it's like first time screening. That's usually how this works. But the same thing when I do screening in Europe or US, right? These are people who do their regular annual screening. They've been having, many of them, right, have been having these screenings for the last 10 years, every year, and things like that. So when they come in, clearly, and if there's an abnormality, it's very, very early, very, because otherwise it would have got detected last year. So that's one thing we are able to see. And the use cases in the US would be more for the sub-segment, sub-cohort of people who are not addressed by the standard of care, because the adoption of screening if you look at it like a screening rate, how many women have had a mammographic screening? If you do a survey of 100 people, how many? So this is about 75% or more in UK and 78% in US as per the recent data, which is close to 25 to 30% of them have not had. In India, this number is 1.3%.
Who have a mammogram?
Who have had a mammogram in the last 2 years.
My God.
98% of them have never had. So this skews the data a lot, but it also means that these kind of tools are super helpful in these areas.
Absolutely.
Yeah. Now, the problem is just because 75% have had a mammogram in UK and US, that doesn't mean they're satisfied with it. 50% of them had dense tissue, so they went for an MRI. So they had to do multiple tests to rule out. There again, our test will be helpful. So we have to get to that cohort of dense breast women in the US. Then this is very, very
then
useful.
this becomes
so
useful.
so when you look at the data,
you
position it in a way that it is actually useful for that country.
In how many countries have you taken NIRAMAI Thermalytix?
So now we do have partners and some users in 22 countries today.
Wow.
It's especially some of the countries recently that are coming in from Caribbean islands and all I've never heard before.
So they identify you and reach out to you?
Because we are in many media and other things. So they
forums.
They get forums. They identify.
So you are the innovator for the world.
NIRAMAI is made a Make in India product for the world for sure. Yeah, definitely. Yeah.
Fantastic. So proud. Hearty congratulations on that. So what do you see is the differentiators in the innovation that is happening in India and, innovation that's happening possibly in the US or Israel or, any of those advanced?
Yeah. No, actually, of course, it's really fascinating to see the type of innovations that, especially medical innovation that's coming out of the US. As you said, Israel is also, working on really fundamental science problems as well. US particularly, I think, has a great ecosystem to nurture research and innovation. I mean, like Boston area, for example, or even, of course, Silicon Valley and other places. Now, in many, many places, you'll see, researchers coming up with specific devices which solve a specific nuance of a particular disease, which is not addressed and so on. There's also a lot of funding, available, at least so far. There was good amount of national level funding that was available. Now it's getting little affected. Having said that, even
how is the India funding scene?
Yeah, so the investor, I'll come back to that. So the investor ecosystem there is more risk taking and so on. So that's sort of the definite ecosystem support is
lot more problems being solved. Correct?
Lot more specific
problems.
Smaller, if I can say that, problems being solved, but going far reaching impact, at least going and getting acquired by other bigger companies so that it reaches the scale, etc. So that's definitely happening. In India, the investor ecosystem is actually developed only in the last decade or so, I would say, very, very strongly. And the VC and others, as I see it, especially after India, Indian startup ecosystem got all the hype and glamour and so on. So there's a lot more startup activity also happening here. Having said that, it's much easier to get funding for a lower risk, medium reward kind of applications. Will be e-commerce or where there's no risk, because it's about also the confidence of the investors on the people who are developing it. Can they really scale up to the world? Can we solve those technical risks that come with the solution and so on as well? So it is pretty hard. Initially it is very, I found it pretty easy to develop this, get the seed funding, the initial early stage part based on the idea and based on the initial prototype. But for scaling, because we end up initially testing out and then doing commercial scaling in India, right? And the pricing that we give in India, the price negotiations that are like that's happening in the healthcare ecosystem here in India that make our revenues go down, though your user base is much bigger. The same thing we can charge almost 40 times in the US, or maybe at least 10 times, if not, right? And so if you have 10 people screening here versus 10 people screening there, you have like 100 times improvement on that. So, so all of this sort of, drives the valuation of the Indian startups lower, or the expectation, even if it's the equal merit from a technology and product perspective. So overall, yes, I think we should think global. From even though you're an Indian startup, think global. And that happened, as you said, as we were discussing. We are in 22 countries. So when we got a US FDA, the adoption in India also increased. I mean, there's no actual connection. We don't need a US FDA to sell in India. But there is this mentality that if US accepts, this is better. If US investors put in, then I will also put. So this, follower mentality is still there. So that is a little bit difficult. And the US investors, when they are investing, they'll think, oh, India, the financial due diligence, the financial policies, import-export policies are so complicated. Why should I put in this? I will rather put in something local and ensure. So these kind of issues come up. So it is harder to get funding, but it's not. Things have been fine so far. I've run the company for 8 years. Fingers crossed.
Things will
scale
and pan out. I think there is a lot more attention right now to this. Maybe a little late, but I think a lot more VC interest at this point of time.
Quite a bit. It's coming in.
So two things here. One is, Bangalore has been ranked high up on the deep tech space. So what do you have to say to the climate that you're working in? How does the Bangalore ecosystem?
I'm a Bangalorean. Not born, but brought up in schooling and education. So it's a really proud moment when I saw Dr. Ekrup Kaur, calling out this on her LinkedIn, as we are the 6th city in the world, right?
From
a
quite
tech hub
phenomenal.
It is phenomenal, definitely, right? And there are only 3 cities, I think, in the top 25 from India. So it's
do you
amazing.
feel it? Does every day in Bangalore feel like you're in a tech hub?
Honestly, I think a decade ago that felt more. Now everybody is sitting at home and hybrid working and all that. It's not in the air, but definitely I think there's a lot of like almost every alternate house has a IT personnel working, be it a male or a
Of course, IT itself is changing, so there must be a lot more into the more strategic ventures, more problem solving.
A lot more startup
startup
activities happening as well, for sure.
One last question before I move on from this thing is, do you think all of the work that's happening on the clinical evaluation, all of that is going to make this entire process DIY? Like your pregnancy test, like, so many things that, you can just do at home instead of going to a doctor at all. Do you envisage that?
Definitely, COVID has taught many people that preventive analysis, preventive healthcare is most important. Prevention is definitely better than cure. Early detection is definitely lower cost of treatment, better status of treatment efficacy, we say, and so on and so forth, right? So that's sort of there's mentality change in the people, citizens, if you will. And the demand actually creates the innovation, right? It's a matter of necessity. So from that perspective, we are seeing a lot more home-based care that is emerging as an innovation. It is also the regulatory landscape for home usage is also being promoted. For example, in the US, there's a new set of reimbursement code that has started for remote procedure monitoring. They say remote patient monitoring, RPM codes, which means that patient is there and after that she goes home, and then for different diseases you can monitor. All those are also, there is separate reimbursement code. That everything is reimbursement based. In
healthcare is all
healthcare, right? So that means it actually nurtures innovation which can be done at home. So home based care is definitely going to pick up, but it's in the preventive space. Just
Understood.
like, glucometers, for example. I think almost every 1 in 3 houses will have a glucometer today.
Yeah.
But I remember, in our father's days, they used to go stand in line at 6 o'clock in the morning to have a fasting blood sugar.
Yes.
That's no more the case. No?
Yes.
So that way we will definitely see more, but preventive in nature.
Understand. We'll step into the challenges and diversity standpoint. So, also the reason why We Women Project came about was how do women handle various things in their corporate life, in their personal life, or, how it builds. So I just wanted to know from you from a gender lens, because all that you say, you're globally making from India, you're right there as a pioneer, but still, has the gender lens ever been applied? Have you ever faced any challenges from that perspective?
I think initially, when I was one of the 2 women in the whole class of 100 plus people in my master's, so there was definitely, people will see that there are only 2 girls in the class, so that was there. But more and more I think about it, even how I was thinking at that time and so on, is that most of these lens biases was in my mind, I felt, rather than others. When you yourself stop seeing that difference, you stop seeing, if at all, there's any difference from outside. So everything is within you. Just here and here. That's what Absolutely. I have understood.
Absolutely.
And once I got that thought, and I tell most people, forget your gender. Just look at yourself as a person and what you are attempting to do, what you want to achieve in the goal. Gender is one aspect of it. Just unless you forget, you cannot give your 100%. So that's my motive. And whatever is happening around, it just doesn't, you should not and you will not notice. So you will be able to give your 100%. So, but I know, I can go into some instances, obviously all of us can think about cases where maybe if a male was saying the same thing, then, it would have been perceived. And of course, even in my career, definitely I know that I had to work double to be treated as equal, which it is not my own experience. And I have heard others also feel the same. But at that time, my goal was, I have to prove that this idea works and I will do it at whatever cost it requires, So when you have that in mindset and not think about why it's happening only to you and all of that, it's just a challenge which is thrown from outside and it lets you give the best. So things are definitely settled down now and a little bit more balanced, I can see.
Yeah. Thanks for that. And also, I kind of wanted to understand from you, you moved from being in a corporate tech to moving into becoming a social entrepreneur. I think that's an entire shift, right? From salary to then going and figuring out prototypes and funding. And so how challenging was that journey, for somebody wanting to do something similar?
So the good part is I didn't think about what could be the challenges when I took the decision. I just said, I really want to make this
you had
work.
A very, very deep
cause. I just said, if I don't do it, nobody else is going to do it, mega thing. And then I said, I'm going to quit because if I don't do it, I'll regret it in my deathbed. That's what was coming in my mind. I said, I have to do it. I'll give it a shot for 2 years. If it doesn't work, I'll go get another job. That was a thought process. But I could see what, for example, an HP or a Xerox badge behind me was adding to my, the first year was very, very difficult. I remember one call which came in Geetha, we want to invite you for a tech talk. And I said, yeah. You're a lab director at Xerox. No, I quit. Oh, okay. Do you know anybody else in Xerox? Boss, you heard me. and you heard me on the talk and then you invited me. No, it's these kind of things.
Yeah.
And, there were hospitals where you go in and you're made to wait hours together to get the 5 minutes, but the same hospital had given me an appointment to come and meet. So these kind of but it's nice that now after 5 to 8 years now, NIRAMAI is also considered as a brand. And like when somebody shows like, oh yeah, NIRAMAI. I mean, it's very nice to see that brand itself being built. But yeah, it's been, and then I used to have my own car, and I used to go, suddenly you change it to auto. So there are all of this. But the only one thing that was driving is that we have to make this happen, right? And when the goal is only that, all these look like frivolous.
It becomes noise.
Yeah, that's okay.
Just put it out.
Yeah.
Did you see this build up to what it is today?
No.
When did it start feeling real?
So in India, I felt when I got a phone call, I think within 2 years itself, I got a phone call from Karnataka Cancer Society President, Mr. Suresh Sir, saying, he just called and said, Geetha, what have you done? It's like, so what happened? I knew there was a camp going on. What happened? And said, I have been in the cancer screening. He's a volunteer, right, from ESI into this. And there are many volunteers who join this. And I've been doing cancer screening for 50 years. Whenever I use the word cancer and go do a camp, women run away. Like, I don't want, and that, this, and all that. But now I'm in front of your camp. There's a line of 50 people waiting, and they're not letting your team close the shop without starting. Even now, I'm getting goosebumps.
Wow. Yeah.
This was crazy. I just said that means women love to take the test.
Yeah.
Because nobody felt that it can be such a private experience and an immediate answer that you can get. So I think that is when I said we definitely have to do it, right? I mean, I still, whenever I'm feeling things are not going well, I remember this phone call. I don't know whether Mr. Suresh sir will remember or not. I definitely remember and cherish that.
Right.
And I mean, that's definitely the moment. Yeah.
I'd love to hear more aha moments. Do you have more?
I have one more. This was, we were doing camps. Like this, we were doing initially free camps and so on. And then we went to another, actually, I wanted to do it for my alma mater, CDAC, the first supercomputer. It is still there. So I told them, like, I want to do it for all the women employees of that. And I went in and we set up a camp booth in the conference room. And I myself went. Initially, of course, I was only doing, I used to have some help, but sometimes I was only doing the screening, and then we had some help, and we did the screening till 7:30. People are coming. 6 o'clock. It's a government. It has to stop. But then 7:30, and I came down, and it was all patched up. And then the director walks in. He had not gone home. He said, "I heard such wonderful experience from this time. Here is the check. It was supposed to be a free camp." He said, "Here is a check. I cannot not pay."
My God.
Yeah. That was my first, it's that
such a validation.
Validation.
Yeah.
And that was my first camp check. And I never imagined, it was whatever amount, but it was a decent amount, right? So that was, there's many, it's really, I think, especially when the feedback comes from the users, and that's where it is really very, very precious.
Yeah. Thank you, Geetha. I've picked your brains a lot. Now we'll do a quick rapid fire.
Okay.
Okay. Just to kind of break the monotony. So is it Bisibelabat or Davangere Benna dosa?
Dosa at any time. But you put two very difficult questions, but definitely dosa.
Dosa at all times?
At all times. Okay. In any place.
I think I know the answer for this one also. Filter coffee or cutting chai?
No, this one would be based on where I am.
Oh, is it? Okay.
North India, cutting chai.
Cutting chai.
Bangalore or Chennai, coffee. Because you get filter coffee named drink in other places, but that's not really what it is.
Absolutely. With you. With you on this. What is one book that you think, made a massive impact on you or changed your thought process?
Actually, of course, I used to read a lot of books in my college, and after that, it's been like browsing that. But one thing that made a huge impact on me is a meditation and yoga course that I did with Art of Living. This is called Just Happiness Program. It's called actually. This is the
I've been on one.
Yeah. So that's been a life-changing experience for me, and I practice it every day.
Yeah, it is powerful.
Sri Ravi Shankar.
Wonderful. Who is one woman in the STEM world whom you greatly admire?
Actually, it's Mary Curie.
Yeah.
Somehow, I mean, I really, at that time, thinking about such wonderful. And then, of course, there is a lot of controversy around it, but she's the one who always comes to be.
Wow, that was a pat answer. And what is one gadget that you compulsorily carry?
Oh my God.
I think I know it.
It has to be a mobile phone.
Oh, I thought you will say the Thermalytix,
No,
the thermal
mobile phone.
The mobile phone.
Because now Thermalytix works on phone as well.
Okay. Yeah. Oh, is it?
Yeah.
Oh.
We are thinking of the do it yourself. We're
Yeah,
thinking
yeah,
about
yeah,
how
yeah,
we can do breast cleaning at home.
Oh, wow.
Yeah.
Okay.
So
Okay.
selfie, call it breast selfie.
Okay.
Yeah.
What is the philosophy of NIRAMAI?
Oh, it's great. Yeah. It's about saving lives with technology, because our core strength is technology, and we definitely we don't call ourselves social enterprise. Of course, we are a for-profit company, but definitely our aim is to make early detection possible and save lives.
And how would you describe your leadership style, Geetha?
Yeah, generally, the way I work is I take inputs from the team and make the decision and own up the decision.
Oh, okay. Lovely. How large is your team?
Now we're about 50 people.
Okay. Okay. Phenomenal. What is your life philosophy in a line?
So I think I was enjoying every day when I was doing the techie stuff, innovative stuff, helping all of that. But and I had in my personal life really enjoyed helping the needy, those kind of things, like many of the people in India and others, right? So now I'm in this culminating beautiful space, and I'm so thankful to be working on this project. So now my life mission is really, if possible, stop deaths due to breast cancer.
Yeah.
And take Thermalytix to every lady on earth.
Phenomenal. Good luck on that. Today, if somebody wants to, start off, how will you guide them, Geetha? AI, healthcare, intersection.
Yeah. First and foremost, identify the problem, what you want to, solve. And there will be many things you don't know about. Don't worry about what you don't know. List what you know, why you are the right person to solve it. You will find ways of finding help for things which you don't know. Everybody cannot know everything. So usually we doubt things which we don't know, and that is what hinders, right? So if you really want to solve a problem, jump, and then you can figure out how to swim. That's what I would say.
Beautiful. Beautiful. Thank you so much, Geetha.
Thank
you for making the time.
No, it's my pleasure.
Coming here in Bombay, being with us and talking about this. All the very best.
Thank you very much,
Thank you for
all the conversation.
Yeah, congratulations on all the accolades.
Thank you so much. Long way to go.
Thank you. Thank you so much for listening to yet another wonderful episode from VWP. It gives us enormous pleasure to create this content for you. If you enjoyed listening to the conversation, please hit the subscribe button and do let us know your favorite moments from the conversation. We would also love to hear if you have any guest recommendations for us. Of course, please don't miss our shorts section where we have our favorite moments compiled in bite-sized formats for you. So keep listening, keep growing, and do subscribe to the We Women Project. This is your host, signing off. Thank you.